Hello everyone. So in this video we are going to talk about calcaneum fracture, a fracture that occurs when the patient or the person falls from a height onto the heels. It is also common among robbers jumping from the roofs. So let's understand some of the anatomy. So we have the calcaneum here with its posterior prolongation, that is tuber calcanei, talus bone which articulates with the calcaneum bone forming the subtalar joint, the tibia and the fibula forming the ankle mortise along with the talus, that is known as the ankle joint, the navicular bone articulating with the talus, the cuboid bone articulating with the calcaneum. Here are the point of interest is calcaneum. The calcaneum elongation posteriorly is tuber calcanei. Superiorly articulates with talus. The axis drawn from the superior articular facet of the calcaneum and the axis drawn from the two tubercles of the calcaneum forms a tuber joint angle. In most cases of calcaneum fracture, this tuber joint angle is reduced. This is what helps us in diagnosis of calcaneum fracture. The cause we already know. The types of calcaneum fracture include either an undisplaced fracture, a fracture involving a part of calcaneum with no displacement of any other part. The extra-articular fracture does not involve the superior articular facet of the calcaneum, so it may run from the tuber calcanei vertically from up to down. Intra-articular fracture occurs in a case of severe fall or injury where we know that calcaneum is a cancellous bone formed by trabeculas. A severe injury or fall leads to a very high stress that leads to crushing down of the trabecula, and the anatomy of the calcaneum is no more maintained. And this intra-articular fracture is what is more common. The clinically patient will give history of fall from height. There will be pain and swelling around the heel as you see in this image. The patient will not be able to bear weight on the affected limb. On examination, there will be marked swelling and heel broadening. Ecchymosis will be visible if the wound is 1 to 2 days fresh. X-ray lateral view is helpful. Rarely an axial view of the heel is required. A lateral X-ray can show an fracture in the calcaneum itself, or in some cases if fracture is not visible, reduction in the tuber joint angle may also suggest a calcaneum fracture. Treatment: an undisplaced fracture, a below-knee plaster cast for 4 weeks is applied and then mobilization is started. Compression fracture are inevitably going to lead to a permanent impairment of function. So most of the cases the treatment is not so much in good response. So most of the times we do different modalities of treatment. This is what is most accepted. A foot is elevated with a well padded knee slab for 2 to 3 weeks. As the pain and swelling subside, we remove the slab and begin ankle mobilization. This ankle mobilization node even